Hello to everyone. A warm welcome on this webinar, and thank you so much for taking your time to be here with us. So before we go forward, I wanted to let you know that we are very happy to announce that PrognoCIS is certified with the latest version of ONC Certification Program, the 2015 edition Cures update. So this is a milestone which we are very excited and happy about. And this webinar is related to and the focus of this webinar is on our new population health dashboard, which is being introduced in 2022 reporting for in PrognoCIS for final data submission to CMS using the API. So just a brief update about the dashboard. This is a multifunctional dashboard with a number of enhanced features, which will experience for eCQM analytics, data submission and also to preview the final scores before you submit it to the CMS. So let me introduce, I am Diya Ranjan from marketing, and let me introduce you to our panelists. We have a versatile group of presenters here with us today. Our first presenter is Julia Young. She will be walking you through the entire presentation. Julia has been for 10 plus years, and she has taken lead role in implementing the software for many practices. So we rely on Julia's expertise in a lot of areas. She will be driving there. On our panelist, our next panelist is Bharati Patan. Bharati is a manager in the compliance division. Been with PrognoCIS for 14 plus years. So Bharati has a wealth of expertise in compliance certification program and also in CMS rules and regulations. So welcome to both of you, Julia and Bharati. And before we begin the webinar, a few housekeeping items as always. We will be having a Q&A session at the webinar. So please type in your questions in the question box on the right-hand side and send it to us. We will answer them in the order we receive. We will also have the recording and the slides of the webinar available to you in the next few days. So you can refer to those after the webinar. So let's begin. Julia, it is over to you now.
Thank you. Thank you everybody for joining to this morning. Today's webinar again is on the new population health QPP dashboard. It's the ONC 2015 edition of the Cures Update Certification Program. Okay, so PrognoCIS is now compliant with the 21st Century Cures Act provisions. ONC 2015 edition of the Cures Act Update Certification, real world testing, attestation, and the ONC CHPL link for detailed information is right here if anybody needs that. The Cures certification criteria list, ONC criteria 15 now, and eCQMs 47, including 5 new measures. Today's course, we're going to cover the changes made in PrognoCIS. We're going to go over the Cures Certification Population Health Dashboard. We're going to learn how to select our eCQM improvement activities and promoting interoperability measures in population health. And we're going to learn how to run our reports, preview scores, submit data to CMS. So we're going to start with the changes in PrognoCIS. Some of you may have already noticed this, but there is a mandatory survey on the login page for the providers. Some of them have already answered this. I'm going to take care of this. The option number 1 is saying that you are a non-participating provider in the CMS EHR incentive program. If you would like to sign up for the eCQM provided by Population Health, you must check option number 2 for individual reporting provider, and option number 3 for group reporting, and then click submit. Option number 4 is saying that you are a participating provider using the claim-based measures as your reporting method. So once you click the survey, you'll get this new icon that looks like this right here on the left. This is your population health icon. And it's going to be located up here from the home page in the middle of your dashboard with your icons. So some of the changes in PrognoCIS are under the settings configuration, QPP setting area, the eCQM settings has now been disabled. So if you come to the settings area to set up your eCQMs, this button is now disabled. You're going to get this pop-up that's going to refer you back to the dashboard. So it shows you the little icon, and then right here, if you click here, it gives you information on your eCQMs. Okay, but if you go ahead and hit OK, it does take you to the eCQM screen, but it will be grayed out, and the options will not be there for you to select. Okay, but if you go to the eCQM screen, you will see that you previously have selected. So when you're setting up your dashboard in population health, you can make sure that you get the same selections. So the changes on the assessment screen, the eCQM button is now, previously it would display the compliance status, the eCQM data and progress. This button is now obsolete. So if you click on the button, you're going to get this pop-up again, referring you back to the population health dashboard. You can click here to see again the details. If you click OK, then you're back out of it. Okay, so how to navigate in population health. When you want to go to population health, you're going to click on your icon from the home screen, which again is located. When you first click on the icon, you'll get this pop-up. It's a user selection pop-up. If you can select an individual provider, or if you select all, it allows you to be a user for a provider. So it doesn't have to be a provider that's entering the information. You can click all, and then you can get set up for your provider. Once you get into population health and you click on, this is your landing page, or the first page that you're going to see. In population health, they capture, calculate, export, report all the data from PrognoCIS, and it displays it in the dashboard. By default, your dashboard will default to the current year and the reporting period for the entire practice. If you want to change or filter out a particular provider or a particular time frame, you can use these filters here and filter out the filters that you would like. Once you've selected all the appropriate options that you would like, then you can click Run, and your measures will be displayed down here at the bottom section of that dashboard. Now, how to navigate through population health is very simple. Over on the left is a menu, and right now it's showing MIPS, quality management, and patient view. If I click on the MIPS heading, I have 4 subheadings below that: preview score dashboard, submission dashboard, improve, and promoting interoperability. If I click on the one that says quality management, I have 1 subheading called eCQM reports. And then if I click on the patient view, I have no additional subheadings. So how are we going to select our eCQM? You're going to go to the quality setting here, and then to eCQM reports. From there, you're going to want to select the year that you're wanting to set the measures up for, whether it was last year or this year. You're going to go ahead and add your tax ID number and the provider NPI number. Then you're going to come up here to this little settings icon up at the top, and you're going to click the settings. It's going to let you pick preferences. This is going to take you to the quality measures, and now you can select your individual measures from here. You do have a scroll bar right here where you can scroll up and down to see the different measures. You can set goals for each individual measure. And up here you have a select all button. So if you wanted to select all the measures at one time, you could do that. Once you've selected all your measures, you want to click Save. Now just remember that the more measures you select, the longer it takes for your report to generate. So only the measures that you have selected will show up now on your dashboard for the quality measure screen. In population health, it retains the preferences for each individual provider. So each individual provider will need to go in with their credentials and set up their individual preferences. Okay, so on the measure options section of that quality measure report, on the left side, you can see the actual measures and the details of those measures. On the right side, you're going to see the status of each one of those measures. Now, each one of these, if you notice there's blue hyperlinks across here, each one of these blue hyperlinks, if you click on it, it will tell you the specific patients that make up that number. As you can see, you have a progress board. So as you are meeting your measures, this progress board will get longer and longer. You have the actual and the targeted percentages that for that measure. You have the IPPs, or individual patient population information. You have your numerators, your exceptions and exclusions, and then you have your your denominators, exceptions and exclusions. Then you have your numerators and your outliers. The eCQM report allows you to run reports on eCQM measures you have chosen and also see those population totals. You can, but from this screen, you can also run a QRD1 report. And over here, you can export the QRD category 3 files, okay? So eCQM reports from the export QRDA category 3 file button, you can also export that QRDA category 3 file in a JSON file, and you can select previous various CMS attestation programs that you want to report for. So you can select different programs from there. Okay. Once you've clicked on one of those blue hyperlinks, it will take you to a screen that looks like this to give you information about that particular measure that you clicked on, or the item that you clicked on. You can transfer from one cross section to another one just by clicking on the blue hyperlinks at the top here. From this screen, you can also export the QRDA1 files, export measure summaries, and then export the patient list as well. Over here, you see that you have the measure ID number, and you have a question mark. This question mark will give you more specific details about the CQM measure that you're looking at. Up here, the summary file will take you back to your report. So if you want to leave this screen and go back to the actual report, you can click here. And notice that you have these like little links here. Those links will take you to a tree structure for condition-wise CQM reporting. You can get to that tree structure from the patient view and also from the CQM view. And what it does is it shows you the structure of that CQM and what that patient met or didn't meet. So it shows you the pass and fails on that CQM. Now, how to select improvement activities. Here, we're going to go up to the MIPS section, and then we're going to go to improvement activities. You're going to want to enter the performance year, tax ID, NPI number, and the start and end date, and then click the, I put it here, click the button to attest. Once you click that button, you'll end up in a screen that looks like this over here. These are all your improvement activities, and the ones that you are going to select, you want to just click the Add button to add those as your measure. The View button will let you see more details about that particular activity. If you want to filter out and search for a particular activity, you can search by a subcategory. And right here it says, please select. You'll click this button, and then you'll get a drop down that looks something like this on the right that is going to have different subcategories that you can select from, and then you can select your categories that way. This is a scroll down bar, so this is only partial list right here. You can also filter out by using the weight. And if you click on this, please select here with the weight, you're going to get a drop down that looks like this, where you can select weight or medium weight, something like that. Or right here, you do have a search field. It's kind of faint on this thing right here, but you do have a search field where you can either enter the name of that activity or the activity ID number to pull it up that way. Once you've selected your activities, they're going to show on your activities dashboard like this. Now, how to select your promoting interoperability measures. When going to promote MIPS and promoting interoperabilities, your measures are going to come up, and you're going to just select the ones that you apply to you. And when you're done, you can hit save. The next section of that is the e-prescribing and the health information exchange. These measures here that you're participating in are going to have numerators and denominators. These numerators and denominators do not automatically populate over from PrognoCIS. So for these, you will need to go to back to PrognoCIS, run the report, and come back here and add the numerator and denominators in these fields. So let me show you how to run that report. You're going to go back to PrognoCIS, into Reports and QPP PI Reports. The report classification is going to be the QPP MIPS PI classification. And then the report that you're going to run is the 2022 MIPS PI, QPP MIPS PI for all locations. You're going to enter your date range that you're running that report for, and then the provider information that you're running, which provider you're running for. Then you're going to click the Go button, and your report is going to run. It's going to look something like this at the bottom. In this section here where it says percentage measures, this is where you're going to get those totals, and you have your numerators and your denominators. So you're going to just take this report, plug these numbers in on that previous page that I just showed you, and then that's how you'll get those measures. And then if you keep going down in this section, you have the immunization reporting. If you participate in that, you're going to click the top button. But if you're taking an exemption for that particular activity, you're going to click the exemption button and make sure that the appropriate exemption is selected. Same thing with the electronic case reporting. You can either select that you're participating with that, or you can take one of the 4 exemptions listed here. The next section is an optional section for reporting. It's worth 5 bonus points. So if you're participating in any one of these 3 activities, you want to go ahead and check here. Make sure that you're saving after you make all your selections. So under Patient View, the Patient View tab allows you to display patients' CQM measures and their status. And it display this particular display shows the patient name, the medical record number, the date of birth, and the gender of that patient. If you need to filter out more about that patient, you can filter out by the name or medical record number here, the gender, provider, or payer. Once you have all the details, you can view more details about a particular patient by clicking on the blue hyperlink for that patient. So you would select a particular patient, and then it will default you to this screen. This is a CCD view. It shows the assessment, the encounter information, results would be labs or radiology tests that you've done, conditions and procedures. And this automatically pulls in from PrognoCIS. If you switch over to the quality button over here to the left, it's going to show you all the quality measures that this patient is eligible for. It's going to show you only the CQMs that have met the denominator. So as long as the denominator has been met, those CQM measures, eCQM measures will be here that you can select again. And here, notice that there is that little icon where you can see that tree that breaks down what the patient was eligible, passed or failed. Okay, you can also export the patient details from here and export the QRD1 category 1 report. So we're going to talk about our preview score dashboard. So the previews to run something on the preview score dashboard, you're first going to go to MIPS and then preview score dashboard up here. You're going to put in the date range or the period that you're running the dashboard for, the tax ID and NPI number you're running for, and select which MIPS program or CMS program that you're going to report for. So this is in group. So right here, we have some special criteria. So if you qualify for the quality/IA special status, you would select one of these options, or the PI re-rate status over here, you can select that option. Once you've had all the criteria entered, you can hit click score. Your scoreboard will look something like this. You'll have your estimated score. This is not your final score, but as you're going through the year, you can check your status and see where you're at with each particular measure. You have your dashboard over here where you can see quality, improvement activities, or PI. And then over here, you can see the percentages, the weightage, and the score over here. Each one of these has a little dashboard down here where you can go and see those activities there. And the scoring is subject to change based on the period, policy updates, eligibility reviews, technical integration developments. This is not your final score. So this is a preview of the score. You can check this anytime throughout the year. Now, how to submit your report data. Before you go in to submit your report data, you want to make sure that you've added all your eCQMs and that your improvement activities are completed. You want to confirm that you're promoting interoperability measures have been selected and your numerators and denominators have been entered manually. And then preview your dashboard for accuracy, see if there's anything that you need to change or fix or anything like that prior to submitting. Submission from the population health dashboard can only be done once. So you want to make sure that everything is completed and everything is done prior to submitting that report. If for any reason you have to do a resubmission, you can download the QRDA3 file in a JSON format, and that file can be uploaded on the QPP CMS website. They will take the higher numbers or the higher. Okay, so how are you going to submit on this dashboard? You're going to go to MIPS up here, and then you're going to go Submission Dashboard, and you're going to enter your HARP credentials into this pop-up that comes up. Once you've done that, you want to make sure that you enter the reporting period year, the tax ID, NPI, and the MIPS program group that you're supporting. Once you get information, you can hit score and then submit, okay? And the submission window is currently open, but however, PrognoCIS interface with the QPP CMS is not yet active. We will let you know when that is active. Everything has been completed on the PrognoCIS side. We're just waiting for the okay from CMS. As soon as we get that go ahead, we will notify you, and then you can go ahead and submit your scores. So important resource information that you may need or want to have handy is the QPP program phone number and their website, their email. And then right below that, we have the website information. On the website, if you go into the resource library, there is a quick start user guide available. You can also visit the Resource Center of PrognoCIS using the Resource Center icon, and then go to the QPP MU updates for 2022 knowledge base information. It's already published there, so you can see that there. And then feel free to reach out to the QPP MU support team. Here's how you can reach them. You can go through the Resource Center. You can click the Manage Cases and put in a request for submission for the 2022 submission attestation, and they will help you. Okay, some benefits from using the population health dashboard is that you can submit as a direct submission from the dashboard straight to the QPP CMS through an API for all three categories, the eCQM, PI, and the AI categories. You can preview your dashboards anytime throughout the year in the reporting period. You can see exactly what makes up your score. You can final preview your score before submission. You have the ability to run the QRDA1 and the QRDA Category 3 reports from Population Health. You have the ability to run a variety of different CMS incentive programs. And then resubmission, if required, you can print out that JSON file. It can be downloaded, and then you can upload it to the CMS website. Okay, so the population health dashboard is available to you now. So if you wanted to start entering your 2023-22 information, you can go ahead and start putting that in. You can also put in the information for your 2023 report. The standard price is going to be $249 per year per provider. For $179 for providers who have attended our webinar for today, clinics who have a representative here for today, as long as you sign up within the next 30 days. And $199 for providers. It's a new promotion for providers who sign up within the next 30 days. Please reach out to the sales team if you have any pricing questions or inquiries. Common questions that we had: can I resubmit the data from Population Health? Direct submission can only be done once. If you need to resubmit anything, you have to download the QRD3 files in the JSON format and then upload those into the CMS website. Do I have to reselect the QPP PI measures, PI and IA measures in Population Health? Yes. So for the selection for the 2022, you do have to go in to the dashboards and go ahead and reselect your measures, but the information should automatically come over. How long does it take to process that information and reflect into the dashboard? Is 48 hours. So if you put it in today, it'll be 2 days from now, and then you'll start seeing your totals for last year. And And you can even go ahead and start setting up your totals for this year. In population health, accessible to users other than the providers? Yes. When you're clicking on the icon, when you first log into population health from the home page, you just choose the all selection and anybody would be able to put in the information for the providers. Can I select eCQ measures for 2023 performance year? Yes, you can go ahead and select those measures. Just don't be submitting anything until we give you the go-ahead to submit. And then for eCQM is condition-wise status available? Yes, and population health under the patient and eCQM report screens, you will see the pass, and you'll click on that little icon that I showed you, and it will you'll be able to see the pass in green and the fails in red, and then you can see the structure tree format. So now those were some anticipated questions that we had. We're going to open it up now for you to ask your questions.
Thank you so much, Julia, for walking us through this population health dashboard. That was a very detailed session, and I hope this training helped all our attendees. Julia, resources for all of you. The information will be available in various areas. You can get it from the resource center. You can contact the MU support team, and you can also contact the sales team. I also wanted to let you know that for people who are new to PrognoCIS and who still do not have PrognoCIS, if you are interested, please contact the sales team. It is sales@bismaticsinc.com. So with that, we, Julia and Bharti, we do have a few questions, and let me, put that over to you. So the very first question is, and this is a series, so I will, once you answer, I will go with the next one. So the first, if a provider answered the poll question incorrectly in the beginning, and the provider does not have the population health dashboard, how do we get it reset?
They can communicate to our support team. We have given the email address of the support team in our this presentation. So they have to communicate to them. So we will make it sure that it will be available for you.
Okay. And a part of this, the next question is additionally, what if they are like the ACO, like accountable care organization? What is there any other steps that they have to follow?
ACOs.
Yeah.
Means I need the clinic information. Then
okay,
we will get back to you on this question.
Yeah. Sure, Bharti. I have the information, and I will share it with you. So just to let you know that we will send you an email with more details. And again, and then again, what would be the correct answer if they report QPP and MIPS? So this is all, this is all from the same person. So maybe we can reach out, Bharti, I will provide you with the email, and we can send the detailed answer in this. So
QPP
the next question,
QPP and MIPS, you can report it through this dashboard. For ACOs, I need the information of the clinic, from the clinic. Need some input from clinic. Yeah.
All right. So we can reach back to the clinic with the information, right?
Yeah.
Okay. So the next question is, and what would be, so the next question is, can we pull the entire agency data at once, or does each need to be provided by the provider?
Entire agency data?
I think it would be like, entire data at once.
Yeah, once you are registered, once you can see your that population health dashboard icon on the PrognoCIS home page, your complete data is processed. So
if you go back to one of the screens that I had, it had a button at the top right corner where you could select which view you wanted to see, if you wanted to see for the entire clinic, or you could drop it down and see for an individual provider. So you could put in the clinic's information, or you could put in the provider information, and then you would be able to see accordingly.
Okay, all right. The next question is on pricing. Is the 2022 submission still free if we don't sign up for 2023? my thing. And Julia, you can say more on this.
Yes, so if you are reporting for 2022, there is no charge. But beginning for 2023, they will be charging for capturing the data throughout the year and then reporting. So it's a one-time fee for the entire year.
Okay, all right.
It's not a month-to-month fee.
Yes. The next question is, this is my company's first year using PrognoCIS, and I'm very new to MIPS. How can I activate my providers to appear on population health?
So it means your provider have not answered those questions on the login pop-up, right? If they have already answered, then you can see the population health icon on the PrognoCIS homepage. But if it is not there, as said earlier, you need to communicate with the support team. We have given the support email ID in this presentation. Can you go back to that slide, Julia, where we have given that support email ID? Or they can go to PrognoCIS Resource Center and they can go to PrognoCIS Resource Center and create the ticket.
Yes.
Yeah, and yeah, Julia and Julia, if you can have the information, all the email address, because there is another question where provider is looking for email address. So maybe it will be good to walk them through the support, through the MU email, and also through the resource and the support and the sales.
Okay, so if you're going to put in information or you need help with any of your reporting, setting it up, anything like that, you can go to the Resource Center. So you go into PrognoCIS. Up at the top right of your homepage, there is an icon for Resource Center. It's an RC button. Okay, you can click on the RC button and you can click Manage Cases. There's also a phone number. So if there's a button in there where it says Manage Cases, you can put in a case and request assistance. There's also a phone button where you can click and you can call somebody from the support team. So either one of those ways would be easy to get a hold of somebody to support to help you walk you through that steps.
Okay, yeah. Thank you, Julia. And there's one more question. I'm not sure, this might be related to a webinar we did earlier, but there is somebody looking for information on electronic remittance payment. So this is not a part of this webinar. We can send you the details of the prior webinar that we did on this topic. So that's all the questions that we have from everyone. If there is anything that you would like, please send it to us. I also wanted to reiterate that we will have the slides and the recording of this presentation available to you in the next few days. So look out for it. And the other thing is that you can avail the recording in different ways, but one of the ways that we have a newsletter which goes out every month to our customers and also those who are wanting to take PrognoCIS. So please use that newsletter. We will have all the information, the recording, the slides. We are also planning to provide you with FAQs. Some of them will be having the questions that you asked during the session. So please sign up and also open our newsletter for all the information. We will have it for you there. So thank you once again, Julia and Bharti, for all the information and for putting up this presentation together. Thank you so much to all our attendees for being here with us today. And you have all the information regarding the email, so please reach out to us. We are more than willing to help you out with any information or any guidance you need. Bye from all of us for now.